This presentation is brought to you by Therapeutic Articulations, the creator of the Mobil-Aider orthopedic device and iOrtho mobile app. This presentation is about ankle and foot mobilizations. We will talk about Talocrural posterior glides for dorsiflexion, anterior glides for plantar flexion, Subtalar medial glides for eversion, and lateral glides for inversion. We will also look at TMT, MTP, and IP glides. First, the Talocrural glide in the posterior direction facilitates dorsiflexion. Here you see the patient positioned with the foot over the edge of the plinth and a towel supporting the distal tibia and fibula. The clinician stabilizes the distal leg by cupping the calcaneus in the hand, and the web space of the other hand contacts the anterior aspect of the talus. A posteriorly directed force is applied to the talus, creating a talocrural posterior glide for dorsiflexion. Here you see the setup for a talocrural glide in the posterior direction using the Mobil-Aider. The patient is in the same position, supine, with the foot over the edge of the table, towel underneath the distal lower leg, and the HE device, or the HE attachment, is donned on the device to perform this mobilization. Here you see a video of the technique performing a posterior glide. The green attachment is donned, the joint line is identified, and the talus is posteriorly glided. And there you can see the grade of mobilization being exquisitely controlled and then quantified by the device. Talocrural anterior glides are used for plantar flexion. In this case, the patient is prone, the foot is over the edge of the table, the clinician stabilizes the distal leg, and the web space of the clinician's hand contacts the posterior aspect of the calcaneus. Notice how the forearm is aligned with the direction of the mobilization, and the mobilizing hand will create an anteriorly directed force through the calcaneus, which mobilizes the talus as well in the anterior direction to facilitate plantar flexion. Here is the Mobil-Aider using the HC attachment, the yellow attachment, to perform an anterior glide of the talocrural joint, again to facilitate plantar flexion. This video depicts that same motion, donning the yellow attachment to contour to the posterior aspect of the leg, identifying the joint line, and then creating an anterior glide for for plantar flexion. Subtalar motions can be performed in either the medial or lateral direction. This is performed in side lying, where you stabilize the tibia with the knee in flexion by wrapping the patient's leg around the rib cage of the clinician. This medial glide is used to improve subtalar eversion, and a force is imparted medially to the calcaneus. This is a downward movement with the thumbs on the talus. Hence, a subtalar medial glide for eversion. In this case, a subtalar motion with the Mobil-Aider is performed with the HE attachment, the green attachment. Again, the same position, and a medial glide is performed to facilitate eversion. This position here is the same for the lateral glide, but the movement is in the upward direction. And this is a lateral glide for inversion. Again, using the Mobil-Aider, the HE attachment, joint lines identified, and a lateral glide is performed and this facilitates eversion. TMT glides can improve overall mobility of the midfoot. And again, anterior and posterior directions can be performed by moving that segment either up or down. For MTP and IP glides, these will improve plantar and dorsiflexion by moving into those respected positions, right, in the plantar or dorsal direction. If you'd like more information about the use of the Mobil-Aider for other joints, please visit iortho.xyz, where you'll find more videos describing the use of the Mobil-Aider to quantify joint mobility for a variety of joints. Thank you.